Homeopathy. The term arrived 200 years ago. Honorable Dr. Samuel Hahnemann invented this therapy, which was popularly known as alternative medicine system. Nowadays, it is popularly known as pain-free medicinal system. Pain-free treatments for all ages with no side effects to human body is the most comfort way of treatment. That is why homeopathy and homeopaths are recognized and respected in the society. Their contribution in medical science is quite admirable. Homeopathy is a holistic system of medicine which has been used by many practitioners. Homeopathy treats a person as a whole. It means that homeopathic treatment focuses on the patient as a person as well as patient's pathological condition. Modern Homeopathy India. The Proven Clinic has turned into a huge research center along with number of clinics connected with an integrated network. The CEO, Dr. Vijay Kumar Mane's devoted research for more than 21 years to cure incurable diseases has definitely transformed conventional homeopathy into modern homeopathy. He has invented the revolutionary curative line of treatment, with the help of which number of patients are being benefited enormously. His 21 years research in cancer, kidney failure and liver cirrhosis has been honored by Lokmat Corporate Excellence Award in 2016 and Shahu Parivartan Award. His community activities includes awareness lectures on cancer for college students and senior citizen groups. Since 2013, the awareness about cancer, liver and kidney failure along with Patients Review, a revolutionary health series named Arogyatsa Modern Yug, being presented on various TV channels. Patients' valuable data and records regarding Dr. Vijay Kumar Mane's greatest achievements in diseases like cancer, kidney failure and liver cirrhosis is time-worthy. Cancer is a cluster of diseases involving abnormal growth of cells with the natural potential to invade or spread into other body parts. It is classified according to the organ affected, type of tissues or cells involved, such as adenocarcinoma of lungs, astrocytoma, osteosarcoma, or according to progressive stage of disease. The prognosis and treatment of different types and stages of cancer varies. It is likely that there will never be a cure for cancer. But Dr. Vijay Kumar Mane's research and his curative line of treatment has termed it as a cure for cancer. Thus, modern homeopathy has become a trusted cure center for many. Let us witness the journey of some cancer-cured patients by modern homeopathy. The journey of life freed from to be off.
Why people have tremendous fear while being diagnosed with cancer? Because there is common notion that cancer is end of life, that is death. However, we have changed this equation by introducing modern homeopathy. We proudly say cancer has a cure. Unlike the other conventional therapies, we at modern homeopathy take lot of efforts to increase patient's life expectancy. Modern homeopathy's medicines reduces pains of patient with speedy improvements. In the line of action, patients' all vital parameters improve significantly. An improvement in appetite, rest time and in patient's general condition proves that the patient is improving significantly. For the safer side, we repeat PET scan, CT scan or cancer parameters after every 3 months. Patient responds very well with our curative line of treatment. Along with clinical improvement, there is also regression or disappearance of tumor seen in subsequent PET scan or CT scans.
Namrata Chauhan, age 22, residence Ratnagiri, acute myeloid leukemia. Namrata Chauhan, at the very young age of 20, got diagnosed with acute myeloid leukemia.
जून 2017 मध्ये मला शिंका, उलट्या, ताप असं असं व्हायला लागलं.
Symptoms were diagnosed and then disease was eventually confirmed. Namrata's parents were informed about the disease with the impression that she is not going to survive anymore. Soon later, she was brought at Modern Homeopathy Center in grave condition. Continuous blood transfusion, deficiency of hemoglobin, lowered platelet counts, and swollenness of spleen caused Namrata pain and fatigue. Looking at her, she had given up surviving hopes. However, since she was in Modern Homeopathy Center, hopes shall last. Dr. Vijay Kumar Mane deeply studied the case with all findings shown in her reports. Namrata's blood cancer was challenged by Dr. Vijay Kumar Mane. At the time of consultation, she was having edema all over body and over abdomen with petechial hemorrhagic spots. Her reports at the time of consultation were as follows. Consultation date 6 June 2017. Bone marrow aspiration report shows that there is increased number of blast, 85%. Some of the blast shows cytoplasmic vacuoles. June 2017. Hemoglobin 3.5 grams. First follow-up 3rd July 2017. Hemoglobin 8 grams. TLC 24,000. Platelets 3,02,000. Second follow-up 3rd August 2017. Hemoglobin 9.2 grams. TLC 16,000. Platelets 2,46,000. Spleen normal. She totally recovered from pancytopenia within 2 months. From last 6 months, she does not require any sort of hospitalization and PCV or platelets transfusion. Thus, she got totally cured from life-threatening acute myeloid leukemia. Arjun Shinde, age 67 years, residence Dombivli, Mumbai, Maharashtra. NHL, non-Hodgkin's lymphoma. Patient was diagnosed with non-Hodgkin's lymphoma type cancer. As usual, he was suggested to undergo 6 chemo in conventional treatments. He undergoes 6 chemo. After 6 months, he was having again same complaints. So onco-physicians repeated his PET scan, which states that NHL was recurred and spreaded extensively in cervical, mediastinal, abdominopelvic or inguinofemoral adenopathy. Again, he suggested for next cycle of 6 chemo. But after initiating chemo, patient's health deteriorated. HB dropped up to 6.5 grams. There was tremendous weight loss and become bedridden. Conventional oncophysicians denies for further treatment and advise to take patient at home. Case of NHL ileum. Staging PET CT scan done in May 2015 revealed active disease in cervical, mediastinal, abdominopelvic or inguinofemoral adenopathy. Hypermetabolic circumferential thickening involving the proximal ascending colon, cecum, appendix, terminal ileum and minimal gastric thickening. Previous PET CT scan done post 4th chemo in September 2015 was suggestive of partial response. Completed 6th chemo in November 2015. Now presents with suspected disease recurrence for restaging evaluation. Compared to the previous PET CT scan done in September 2015, scan findings reveal significant increase in size and metabolic activity of the thickening involving the cecum, appendix, terminal ileum and minimal gastric thickening. Diffuse increase in metabolic activity of the spleen. Lymphomatous involvement or reticuloendothelial hyperplasia. Persistence of hypermetabolism in marrow of the visualized bones is noted. No active disease elsewhere in the body. The above scan findings favor disease relapse. At this critical stage, we initiated our homeopathic line of treatment and we succeed. Within 15 days, his condition improves dramatically. His appetite improves. HB improves up to 11.3 grams. His PET scan was done on 15 February 2017, which shows that there were a complete metabolic regression with significant decrease in size of the mediastinal, cardiophrenic and abdominopelvic nodes. There were a complete metabolic and near total morphological regression of the thickening involving the cecum, appendix, terminal ileum and minimal thickening. Complete regression of the hypermetabolism in the spleen and marrow of the visualized bones observed. No active disease found elsewhere in the body. Mirabai Mehekari, age 78 years, residence Amravati, esophagus cancer.
मला अशक्तपणा वाटत होता, अन्न घेताना त्रास, चहा घेताना मला त्रास होत होता.
Vomiting, fainting, diarrhea and weakness were the significant symptoms, leading her to get admitted in hospital, where she was recommended for endoscopy and biopsy investigations. The report shows a large ulcer in the path of esophagus. Later, a biopsy confirms a development of squamous cell carcinoma. Considering her age factor, she was advised to undergo radiation. Meanwhile, Mirabai's son, Sri Vinod Mehekari, came in contact with modern homeopathy and consulted Dr. Vijay Kumar Mane with reports of his mother. Her histopath report shows that she was having squamous cell carcinoma. Large ulcer was seen at 22 centimeters from incisors. After our treatment, first follow-up, 30 October 2015, she is able to take semi-solid food. Second follow-up, 30 January 2016, dysphagia completely reduced. Third follow-up, 16 March 2016, she was asymptomatic. Seventh follow-up, 12 February 2017. Patient got totally cured from CA esophagus only with homeopathic line of treatments. No chemo, no radiation, no surgery. Fourth follow-up was done on 16th May 2016. In CT scan, mild irregular, mild thickening of upper mid-esophagus was seen extending for the length of approximately 2.5 centimeters with minimal irregular narrowing of lumen. Fifth follow-up was done on 2nd September 2016. She was asymptomatic. Sixth follow-up was done on 24th January 2017. No obvious wall thickening of thoracic esophagus or loss of surrounding fat planes. Correlation with Scopy findings for complete resolution of disease process. No metastatic lesion in either lung or mediastinal lymphadenopathy.
The World Health Organization estimates that the homeopathy is used by 500 million people worldwide, making it the second most medical pathy in the world for the treatment of grave diseases. Modern homeopathy has proved fighting with the cancer is not only the resolution but a revolution. A ray of hopes and happiness in patients makes us feel proud.